Today, we're talking shoulder pain, and specifically about one muscle that seems to be forgotten about when it comes to shoulder injuries. Shoulder impingement and just general shoulder pain. That muscle is the serratus anterior. The serratus anterior is considered a chest muscle or a thoracic cavity muscle because it connects the upper 8 to 9 ribs to the middle of the shoulder blade. So if you look here, you can see the serratus anterior. It's going to wrap around the chest and then connect here to the midline of the scapula on that inside border. This muscle, when it contracts, pulls the shoulder forward into the outside of the rib cage, or more specifically, causes protraction and upward rotation of the scapulothoracic joint. The serratus anterior is also known as the puncher's muscle because it allows, again, that protraction of the arm, meaning, again, allowing the scapula to come forward and around the rib cage. The serratus anterior also helps with the stabilization of the entire shoulder complex. Nearly any pushing movement, lowering or raising of the arm is going to involve the serratus anterior to some extent. For instance, when you're doing a push-up, your chest muscle, the pec, and the triceps are doing the main pushing movement and extension of the elbow. The serratus anterior during this time is contracting, keeping the scapula against the thorax in order to maintain stability of the shoulder joint and not allowing the scapula to wing, putting more pressure on the rotator cuff muscles. During the end range of motion of the push-up, the serratus anterior is going to be doing the majority of the work, as the serratus anterior is going to act as a pulling the chest and the trunk up to the scapula. The serratus anterior is therefore very important when it comes to the integrity of the shoulder and the function of the surrounding muscles. For instance, the serratus anterior works with the trapezius muscle, this muscle right along here, to upwardly rotate the scapula. This coupling of these two muscles working together is done when we raise our arm to our side, even though the primary movers are the deltoid and the supraspinatus, one of the rotator cuff muscles. Therefore, when the serratus anterior is weak, injured, or unable to properly coordinate movement, it can cause pain, the mimicking of shoulder impingement, and abnormal motion of the entire shoulder complex. In one research study, they looked at how a weak serratus anterior affected the ability to move the arm up and to the side. What they found is that when the serratus anterior is weak, the ability to bring the arm forward and to the side decreases. Another research study looked at what happens to the surrounding tissues and muscles when there's a weak serratus anterior. Earlier, we talked about how the serratus anterior isn't the main muscle involved in bringing the arm forward or to the side. That's going to be the deltoid and the supraspinatus. However, when there is weakness of the serratus anterior and we try to raise our arm to the front or to the side, the deltoid and the supraspinatus is actually going to pull the scapula down, causing it to internally rotate, causing the scapula to wing. This abnormal position of the scapula then hinders every single movement that we do with our shoulder. If this winged abnormal position is maintained, it can cause the pec minor to shorten and get tighter. Since the rotator muscles connect the scapula to the humerus, our arm, when the scapula is in an abnormal position, it's going to alter the natural pull of the rotator cuff muscles. In some individuals, this can cause compression or shearing of the supraspinatus muscle, also known as the most injured rotator cuff muscle. Maybe there's a coincidence there. So now we know what the serratus anterior does and its importance when it comes to any movement of the shoulder. Now, let's learn how to strengthen the serratus anterior muscle. The first movement we're going to do is towel wall slides. You're going to face the wall and your arm's going to be at a 90-degree angle. You're going to be just a distance away from the wall, just straight line with the body, arm against the wall, and then you're going to be pushing up against the wall and then out at a 30-degree angle like this. So this is how it's going to look from the side, right here. And now let's show you what it's going to look like from the back. Okay, so you're up against the wall. Your arm is at a 90-degree angle, okay? Arm right here. You aren't pushing super hard into the wall. You're just maintaining that pressure, Okay, get a towel so it slides against the wall easier, and you're just going up and out at a 30-degree angle. This shouldn't be here, so I'm going up and out like this. So here's a better look at that. Going up and out, and then bring it back down. You're going at about a 30-degree angle, reaching out, and then coming back down. Again, out, and then back. For the next movement, what you're going to be doing is you're going to be laying on your back. You're going to have a light weight in your arm. You're going to lift that arm up. It's going to be straight up facing the ceiling. And what you're doing is you're just pushing your shoulder and arm forward. Just pushing it forward as far as you can, and then back down. For the last movement, you're going to be in a plank position just like this. And what you're doing is you're going to relax your shoulders, your thorax down into a relaxed position, and then you're going to push up, trying to push your thorax up through the ceiling. So here, and then there. I hope these movements help you, and if you're looking for an individualized, data-driven approach to help you get out of pain, move better, and function better, give us a call at 614-769-7831 or visit us online at datadrivenchiropractic.com. Hope you have an absolutely wonderful day.